Bulkamid is a minimally invasive, no incision surgery for the treatment of stress urinary incontinence. It can be done in an outpatient setting, typically at their surgery center with some local sedation, but does have the application, given the minimally invasiveness, to be done in the office setting as well. So the initial kind of evaluation for stress incontinence is an office evaluation with the patient, and if they meet the criteria for symptomatic bothersome stress incontinence, then they're given different treatment options regarding urethral bulking or sling surgery or pelvic floor physical therapy. If they elect to proceed with urethral bulking with Bulkamid, then it's again an outpatient operation. Patients come in, little local sedation with a procedure. Basically, it's a no incision procedure, so it's just like a glorified cystoscopy. The scope itself is placed into the urethra, so the lumen of the urethra where folks pee, the scope goes in that area. So there's no outside cutting, and then once we get in there, we basically just pass a needle through the scope, and it's just basically 4 needle sticks within the urethra to inject the hydrogel. Elderly patients that can't undergo full general anesthesia are great candidates for the bulking procedure. If they have mild to moderate incontinence and they don't want to proceed with a full invasive surgery or a mesh implant, then the younger crowd of folks also are good candidates for the bulking. But it doesn't really exclude anybody. It has good success kind of across the board with all patients. The procedure itself takes about 10 minutes to do, so they go home the same day. Unlike some of the other more invasive treatments for stress incontinence, they don't have to have a catheter after surgery. Other than just letting the anesthesia wear off, there's basically no restrictions after the first 24 hours. They can go back to their normal day-to-day habits. It's exciting to be able to have with us, at the forefront of urology, to have newer techniques, less invasive techniques. It improves patient satisfaction. It diminishes hospital stay. Some of the morbidity of some of the more invasive procedures as well is significantly reduced as a result of these less invasive options. So, just having the application, the availability to offer patients some less invasive treatment options with similar results is gratifying to have.